Hello friends, I am Dr. Sadeep. In my channel, I'll be uploading videos concerning practical applications of homeopathy and how to practice homeopathy in a classical way. In this series, I have done so many videos on this subject. Friends, if you are interested in this type of topics, please like, share and subscribe our channel. Today topic is very important. So, we are in a position to find the proper indicated homeopathic in Similimum. So there will be a confusion in the beginning homeopathic practitioners to how to differentiate one medicine from the other medicine. Or there are two medicines we are very nearby and they are suiting the totality of the symptoms of the patients, which to give, which not to give, how to decide on that. So there are so many dimensions wherein you can recognize the features. There are so many aspects. You can recognize the features and find a symptom similarity medicine, what is called as Similimum, what is required for the patient. So in this aspect, there are three dimensions I will be talking about. One is miasmatic aspect. So miasm, if you properly pinpoint the miasm for which the patient is pointing towards, this is one of the indication of the patient's individuality. So next is the totality of the symptoms, wherein the not only a manual totality or just an aggregation of symptoms totality, no, it is a totality wherein mind, body and the spirit aspect must be covered. So some medicines will have a lesser ranking. It must be in a third position or the fifth position, but might be this is a very important medicine for the patient which may cure the total individual patient. So we must look for the totality of the symptoms on the body, on the mind and on the spiritual level. So this is one of the important feature. Only when we repertorize, only the top medicine we must not look into. We must look up to 10 numbers, that is up to 1 to 10 numbers. We must have a focus on all the 10 numbers, so that which medicine is striking and matching in his body aspect, in his spiritual aspect, in his mental aspect. Then the medicine will do a miraculous effect on the human economy. So this is one of the important feature. One is miasmatic aspect, you must be very concerned about. So if the miasm is not matched, the totality of the medicine will never do miracles in the patients or improvement in the patients. So miasm you must have a thorough knowledge of, and totality is not just an aggregation of the symptoms, it is a totality of the individual which in he is presenting his mind aspect, his body aspect and his spiritual aspects. So this is the other dimension what you must look into. Another dimension of looking is hot and cold. Say there are few medicines which are very sensitive to hot, which are very sensitive to cold. So if you have a very keen observing mind, then what is his general susceptibility? What is his main triggering factor which is affecting him, his body, mind and his attitude? If he is affected by cold, then he is a chilly patient. If he is affected by hot, then he is a if he is affected by cold, he is a chilly patient. If he is affected by hot, then he is a hot patient. So he can't tolerate any heat. So then he is a hot patient. I have done a total video on this hot and chilly patient. Friends, if you have not seen, please see that video. So this is one of the important recognizing feature to differentiate the medicines. So sometimes you will be recognizing, sometimes you will be just overlooking that. So you must be very keen in applying the principles. You must be very keen in observing the patients, his movements, his facial expressions and everything. If you come into considerations, then it is very easy to differentiate pulsatilla and bryonia. Both are hot patients. See, both are hot patients. See, pulsatilla is also hot and bryonia is also hot. So both are hot patients, then the problem comes. So then how we can recognize? So this is one of the important features. Then we must go to the modality aspect. If you go to the modality aspect, pulsatilla will present in a different way, and his mood swinging, his sensitivity is totally different. And if you come to bryonia, bryonia is more adamant, more calculative, more business oriented. So bryonia has a different total set of symptoms, and pulsatilla has a different set of symptoms. So bryonia is thirsty, pulsatilla is thirstless. So there are so many things which a physician must look into. Due to that reason, I am just making this video, friends, because there are many beginning practitioners, homeopathic practitioners, who are struck in this a very small issue. But the thing is, it has a very proper and sure short answers if you see it in a deeper way, see it in a very proper way, in a systematic way. So this is all I wanted to explain you today, friends. If you like this video, please like, share and subscribe our channel. If you have any queries, put in the comment section. In the future also, I'll be doing such videos. If you have any subject affinities or subject interest, please put in the comment section. I will be doing such videos also, friends. This is all today. Thank you and take care.